Hello friends, have you recently visited a dentist and got your RCT done, that is root canal treatment done, and now he or she, the dentist, has suggested you to place a cap and you are really confused that do I really need a cap, or is the dentist just suggesting me a cap because he wants to extract some money, or if I can just postpone the application of cap for some months because I am into financial crisis, or maybe I don't feel the need to do that. So what is it? So in this video, we will have a look at this problem of yours, and I'm sure that you will definitely find an answer of what can be done. Should I apply a cap or should I not apply a cap? Come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. Friends, in this today's video we are here to understand why should we apply cap, or why a dentist suggests a cap on an RC treated tooth. So the first and the foremost thing that you should know, that why should a cap be placed. So friends, remember that whenever we have done an RCT to a tooth, that means the tooth has been drilled. It has been filled with an artificial material, right? Now, you have already spent so much in protecting that tooth and keeping your natural tooth in place by doing an RCT, right? You have also spent, and I would say you have also invested so much of time in it. Now, if that structure which you have saved is a little weak, it is little incapable of taking all the forces which your natural tooth, initial tooth was able to take, what would you do? You would like to reinforce it with some more structure so that the tooth which you have saved with so much efforts would stay there and act as a natural tooth, isn't it? So that's why a cap is suggested. So whenever you place a cap on a tooth, the structure, the original shape of the tooth is restored, one. Second, the weakened tooth structure becomes stronger by this cap. And third is that you are able to chew very naturally and normally with this cap or the new structure which is placed in your mouth. Hence, a cap is very much important. Now know that if you don't place a cap, there are much more chances that the structure which is under the cap, that is the original tooth, that is very weak and brittle. And there are chances that it might just fall off, there might be breakage. There are chances that if you don't place a cap, a lot of food lodgement will take place because there is some or the other gap which is remaining, right? So with this food lodgement, what will happen? More cavity, more caries, and that will lead to decay of the tooth and damage the tooth again. And do you know that root canal treated tooth can also be reinfected? Yes. So once there is food lodgement, there can be cavity, there can be reinfection, and you have to again undergo this root canal procedure. So what is to be done? Place a cap. Yes, that is a proper and appropriate solution. Now there are various types and varieties of caps which are available, and your dentist must have definitely discussed it with you. So if your dentist has not discussed it with you, or if you want to know what are the types of the caps and which one is the best, you can watch this video which I am sharing the link here, and know what are the types of the caps which are available and which one is appropriate for you. Now coming to a point that when should I apply a cap? Now if it is a molar, that is if they are your back tooth, then it is must that within a week, 10 days, you should go for a cap. Now what is the criteria? I would say that you have undergone a root canal treatment. So after this root canal treatment, we dentists expect that the pain should completely subside, and there might be a bit of sensitivity, or you can say a little bit of pain which occurs upon biting something very hard. But the major pain which you were suffering from should wear off. If that is there, then it is an appropriate right time to go for the cap. And we mostly wait for a week or 10 days to know that what is the reaction of the tooth. Sometimes even after undergoing a root canal treatment, there are chances that the tooth is paining because the tooth anatomy is very complex. It sometimes have 3, 4, 5, 6, n number of canals and n number of lateral canals. Now what is this canals and lateral canals? It is basically the roots your teeth has, and any of the roots can get infected. If a single root or a lateral root is left off of cleaning, or if there is some bacteria which is left off, the tooth might show symptoms and it might pain. Now, we have definitely done our 100% and given it a 100% try that the root canal is done at its best. But there are chances, because it is our body. It can react in n number of different ways, right? So, we wait, we watch what is to be done. And if it is good to go, then okay. It is good for a cap placement. Because once we apply cap, it is difficult to remove it. We either have to cut it or either have to pull it, which can damage the underlying tooth structure. So, hence it is better that you wait, be patient, and then go for a cap. Also, if you are operating on a molar tooth, it is very much important, because these teeth, the back teeth, the molars, they are the main part, or they are the main tooth which are chewing your food down. They are crushing everything up, right? So you need them to be stronger and you need them to be in place. So it is very much important to avoid reinfection, recavitation and breakage of the RC treated tooth, that you have a cap done. Now for anteriors, that is your front teeth. For this teeth, it is okay if you sometimes wait or avoid a cap. Now that depends on the structure of the tooth. If a lot of structure has been damaged with the cavities, like this shown in the picture, then you must definitely have a cap done. But if there is just a small cavity which can be filled with a filling, and the root canal can be easily aesthetically managed by the dentist, then you can definitely wait before applying cap. Now there is a treatment called as post-in-core, which reinforces and strengthens the tooth from inside, and you can sometimes avoid this cap. But for how many years can you avoid? You can avoid it till the tooth starts turning black. If the tooth is white enough, it is not having much of shade difference, then you can definitely avoid and wait for some years more to place a cap, because these teeth are not chewing teeth. They are just used for biting. So that much force that teeth with a post-in-core can bear. As I mentioned that the tooth starts changing the color. Now what is that? As in a root canal treatment, the tooth becomes dead from inside. We remove all the material which is decayed or it is damaged by the bacteria. We remove it and place an artificial nerve. In layman's term, I will say, we place an artificial nerve inside this tooth. So the tooth is completely sealed, but it is dead somewhere. So it is just there in its position. It will perform its work, but it is dead, and hence a dead tissue will start turning black. So with some years, it will start turning black. In some cases, it might not also. Like, it will start turning, but it might not show that much. So it is okay if you don't place a cap on the anteriors, but make sure that you go for a post-in-core treatment instead of it. So, but if you have to aesthetically correct your teeth, or you are in much more wish that, okay, I might as well, if I am getting operated a tooth, I have some aesthetic issues with that tooth and I want a perfect smile, then you can definitely opt for a cap immediately. Veneers in that case might also help. So friends, it is very much important that you have a cap treatment done, because it is going to save your tooth and the RCT treatment that you have undergone. So make sure that after every root canal treatment, you opt for a cap. And as I said, you can wait and not wait in what all cases we have discussed it. Friends, if you have any other questions related to your dental health, to your oral hygiene, you are free to ask here in the comment section. I'm sure I'll reach you out and I'll be very glad to help you out. Till then, like, comment, share and subscribe to my channel, Dr. Mansi Shah. Wishing you all a very happy and a pain-free smile. Stay healthy and stay over fit. Thank you.